excited for you to learn a little bit more and to get a bit of an update from what's going on at Nationwide Children's Hospital. So we have some guests joining us today. I'm going to let Lori, who's our resident Nationwide expert, introduce Mary Kay and share a little bit about what's going on at Nationwide and then some ways that we can kind of help support that effort. So, great.
Hi, my name is Lori Shooter, and I'm a nurse practitioner at the School-Based Health Center in the Mount Vernon High School. And I just like to introduce Mary Kay, and she is our Senior Director of School Health, and she's going to present more about our clinic.
Yeah. Good afternoon. Happy to be here. We've been here now for a couple years, so I thought it was a good time to come officially to the board meeting and give you an update on the partnership and give you an opportunity to ask questions. I do, and companies like this like to share that I started my career as a teacher. So I taught school for 6 years before transitioning into healthcare, and I've been into healthcare for over 20. And I've spent those 20 years integrating school and health on behalf of pediatric patients. So it's a passion of mine, but I feel among peers every time I get to come to a school. So a little bit about, there we go. A little bit about the why. So why school health? So you're likely familiar with, there's quite a bit of research that really helps to illustrate how dynamically intertwined health and education are, such that children who are healthy do better in school. Those that do better in school go on to live healthier lives. And there's a lot of data even to suggest that when children have access to routine healthcare, they're more likely to graduate high school, they're more likely to be gainfully employed, have health insurance. And when people have health insurance, they actually go to the doctor and participate in protective care. And so there is just a lot of reasons to do this work and to collaborate with school professionals. And what our aim and our why at Nationwide Children's is to find ways to create unique access points to care, in particular for children who don't have access to a routine medical home. So that is why we do the work. This is a bit of a peek around school health status for Ohioans. And so you can see the statistics here just further substantiate the rationale and are really tell a story of why you see such an emphasis of school health in the state of Ohio. So when I came to Nationwide Children's in 2015, there were not very many school health centers in our state. In fact, the preponderance of them were in Cincinnati, Ohio, but the rest of the state didn't have much to speak of. And thanks to Governor DeWine and his passion, for really families in general, overall well-being, and seeing this as an opportunity, he has availed our state of a ton of resources. And so now we're at a situation in which the Department of Education and Workforce, Department of Health, the Department of Medicaid, the Governor's Office of Appalachia sees this as a solution for children and families in our state. And so we are in a totally different situation, have seen dramatic growth of school health. And now we have representation of school health clinics all over our state, and we anticipate more to come. So this is a little bit of when you sort of break it into health and academic benefits of why do school health. So we know, I already alluded to from a health perspective, we know that children who have access to timely health care, timely medications, and let me say also high quality, comprehensive care, they have improved physical outcomes, mental health outcomes, reduced hospitalization, and live the lives that we hope to all live. From an academic perspective, we expect lower rates of absenteeism. So we want to be seeing that we're helping to improve chronic absenteeism wherever we provide services. When we do primary care mental health, which is taking care of the mental health needs of students, we would anticipate that we would be helping to reduce disciplinary rates, right? So any good health partner is holding themselves accountable, not just to improving health outcomes, but in a true partnership way with the district to try and improve your academic outcomes in collaboration.
All right.
This is a peek at the school-based health centers that we run. We did a study around what's called saved seat time. And everyone knows inherently that if you bring healthcare services to school, you must be improving attendance. But there's not a lot in the literature about this. It's sort of like an assumed, everybody just believes it to be true without a ton of evidence. And so we have done a couple of different things with our school-based health centers. First is a match study where we looked at similar schools that did not have school-based health centers compared to the similar schools that did. And we found that those that had a school-based health center overall had a 3% improved attendance rate. And then also when we looked at children in a particular school that had access to a school-based health center, so those that did go and use the center versus those that did not, and we actually saw the same percentage, a 3% increase. And then the other side of that line is something called saved seat time. So the National School-Based Health Alliance really holds this model up as a way to measure improved attendance when you have school health going on. So essentially what happens oftentimes when a child leaves school to go to the doctor is that mom sometimes takes out multiple kids because she's not going to be home to receive the others off the bus. Or it could be that the doctor is far away, or after the appointment, oh, you missed lunch, let's hit up McDonald's. Now there's only an hour left. Is it worth going back, right? And we even sometimes have providers saying, oh, you want me to write you off the rest of the day? Well, I think the challenge is in our state, when we have such a chronic absenteeism rate, we really need to be thinking about how we improve seat time, right? The academic time in the classroom. So we did a study across our school-based health centers, and what saved seat time is the definition of it is the amount of time saved at the end of the appointment to the end of the school day. So in other words, a child going to a school-based health center is going to have how many saved seat minutes compared to somebody who went to an outside appointment, right? And so what we found overall is that for every single appointment that a child has in our school-based health centers is we are saving a little bit over 3 hours of saved seat time per appointment. So just some ways to look at this in terms of how we can help improve attendance. So we're a huge operation, but the 4 faces on here are probably the most relevant to the Mount Vernon partnership. Me, less so up there in that corner. The other women on here are much more important. So Lori, the nurse practitioner, obviously, Jennifer and Bridget. And so Lori and Jennifer are here staffing the clinic, and Bridget is in a role called School Health Liaison, and her job is to help with engagement, marketing, communications, pulling data if you want to review that with regularity, which we do, with the school staff. And then this is a quick peek at the services that we offer. So anywhere we provide a school-based health center, we are committed to comprehensive primary care. So we are going to do everything from soup to nuts because we want to be comprehensive, right? And so that is well visits, vaccinations, that is acute sick visits. And at this point, we have a lot of capacity, so we can do same day without a problem. Also sports physicals, work permits, and chronic disease management. So helping children to really manage their own diabetes, manage their own asthma, work on nutrition, obesity, all those things are available in the clinic. And then also what we call primary care mental health. So primary care providers are capable of helping with a mental health load when they are trained. And so we work hard with our nurse practitioners to help them feel comfortable using that aspect of their license. So we kind of talk about working to the top of the license. The license allows it, but a lot don't do it. So we lean on our large psychiatry department to help with training so that the nurse practitioners are well-versed in the diagnosis and the medication management of anxiety, depression, ADHD, and as that becomes comfortable, then even moving on to other things like oppositional defiant disorder, etc. To be clear, this is not a replacement for therapy, right? That what we're trying to do in this service is to fill a gap. And we know that not only here in Mount Vernon, but across the state and the nation, we have a workforce shortage of mental health professionals. It's a problem everywhere. So there are a lot of people working on the long-term solution for that. So that's like pipeline development, where we're encouraging young people to go into these professions, therapy, psychology, psychiatry. And that work is critical, but it doesn't fix today's problem, right? And so the biggest gap seems to be the ability to have somebody who's trained in the diagnosis and med management for those who need meds, because not everyone does, of course. This is not duplicative of school-based therapy. It's a complement. So we can do this in our clinic where we can fill that gap, and we do the straightforward, I'm going to say, ADHD, anxiety, depression, thereby pulling those kids off of the wish list of the psychiatrist, because the psychiatrist, really, we want to preserve that for the children who are a little bit more challenged by their issues. And then when the nurse practitioner in the school health clinic says, okay, I thought this was going to be straightforward and the child is not responding like I thought, we need the expert, then we offer telepsychiatry so that the child can be seen via telepsychiatry right there in that school clinic with mom, dad, if they want to speakerphone in, if they want to FaceTime it or even come into the appointment in collaboration with the staff. This has worked very well for us, and we have effectively reduced the NCH psychiatry wait time effectively by doing this. And more importantly, Mount Vernon students can be seen by both Lori and or the psychiatrist if needed with next to no wait, which would not be the case at main campus. So just a bit about our numbers here. In the last school year, you can see we had a total of 471 visits. That was an average of 3 visits per day. What I will share with you is we have a lot of unused capacity. And so we would like to see more kids. We would be really trying to hopefully be seeing 12 to 14 a day would be the goal. It's important to know that we are not trying to replace relationships that people have with their family physicians. So those relationships should remain intact. If someone is in a relationship with a pediatrician in town, but say they can't get in, they're welcome to use us for a quick convenience appointment. What we do then is send what we call an after-visit summary back to that child's pediatrician so they know, hey, we got them in real quick for a strep test, and here's the results. And we encourage that family to do the follow-up with their pediatrician and to maintain that relationship. When we decided to come to Mount Vernon, this was not just because, right? So we used data and we looked at the pediatric health outcomes and utilization in your region, and we could tell that there were a preponderance of children who don't have those relationships. So we really came here for that. We really came to create this unique access point for kids who were either just going to an urgent care or maybe to like a clinic that is, in a grocery store, for example. And those situations don't provide that high quality comprehensive care, right? That preventive wellness, the chronic disease management. And so that's why we came. So that remains our mission. We are open to anyone and everyone. So for folks who have a physician in need and want to use us for something quick, they're welcome to do so. But we certainly want to be the medical home and connecting for those kids who don't have one, so we can take comprehensive care of those children and families. And then Mount Vernon city students are always going to be our first priority, but we're also open to children and adolescents from the community. And we can see children 0, so we can see babies all the way up to age 22. So even for those that, career tech and kids in college. And often in some of our other school-based health centers that have been open for a while, we find, that the 18, 19-year-old wants to come back because they've formed a relationship with their provider. So that is the goal, and that's how we're doing today. We spent some time at our kickoff meeting kind of talking about some of the barriers and maybe some of the solutions with superintendent, with the building principals, with school nurses. I do think there's probably some more opportunity from a marketing standpoint so people know exactly what we have to offer, what we're here to do and why, and to address any uncertainty if people are scratching their head, like what's really going on, which is one of my purposes here today. And then also to talk about the transportation opportunity, which is bringing the children from the nearby schools to where the clinic is. So the team has been wonderful working with Lori and with the team around strategies to kind of address these 3 things, as I mentioned, so we can take better care of the kids who need us in this community. So in review, we are really trying to focus on students and families that are overdue and are not connected. And then we want to be your whole child partner. We want to be a gap filler. We want to work in collaboration with your special education staff, with your nursing staff, your guidance staff, to address the concerns that you have for the children and adolescents that you guys are responsible for. So this is a picture of our 2 esteemed colleagues. And I think they were in theme on this particular day, matching what you guys were doing in theme. But this is just a quick peek at some of the things that we've done just as of late. So I always say, to me, we have really reached success when the community isn't really sure. I mean, sure, Nationwide Children's, we're always going to hold ourselves to that standard of care. But the moment these women are mistaken for Mount Vernon employees and they just think that they're a part of this district, that means we won, right? Because we're trying to be ingratiated in this community. So to the extent that folks have other ideas of how we meet more families and offer our services, we are open to your suggestions now, in the future. Because this does oftentimes, when you're trying to reach those who are disconnected, it takes